Steph, I got this new juicy story from my team about this crazy OSHA story.
You know I love these. Okay, go on. Hit me with it.
So to set the stage, this practice receives this notice from OSHA saying that they had received this anonymous tip and they didn't respond to it. And then all of a sudden, OSHA is showing up at their practice. So the whole thing started because they just had a little bit of mold growing in a cabinet, something that any practice can have because there's some things that you just don't open up, right?
Yep.
And so they decided to solve that problem, but then didn't respond to the OSHA letter.
My gosh. I know that I kick all my compliance issues to you, but I know you at least replied to the letter. Why do you think they didn't reply?
I can only imagine that it's just this Pandora box that they're not wanting to deal with. So they've got, oh, it's OSHA or it's something scary. I don't understand it. If I don't see it, then it can't see me. And so there's always these people that are just looking to figure out how can I just pass this off to somebody else. And that's exactly what happened here. Nobody knew what was going on and who was responsible for it. So the doctor thought that the staff was cleaning the cabinets, and the staff thought that the cleaning crew was cleaning it, and the cleaning crew said, well, no, we don't do the clinical areas. And so everybody was just saying it's somebody else's job.
So if no one seemed to have responsibility for it, how did OSHA even find out about this one?
So I'm going to have to get on my little soapbox and rant for a minute.
Okay.
Because taking a step back, OSHA typically in dental practices, 90% of OSHA incidents are reported by a disgruntled employee. However, post-COVID, now we have an influx of even patients that send an anonymous tip to either OSHA or Health and Human Services. Health and Human Services just kicks that over to OSHA. And that's probably what happened here is somebody, probably a patient even, saw something they didn't like and said, that's not safe. You're going to infect people. And I don't like that. And OSHA is required by law to respond to every complaint they receive, no matter how ridiculous it sounds.
Okay, so then we don't know where their complaint came from, but you said that they fixed it, but OSHA still came. So what happened there?
The practice went through, they quickly remedied the issue, they cleaned up, even replaced the cabinets, so they weren't cutting corners, but they just simply didn't respond to the letter.
Oh, you said that. They didn't respond to the letter. Dang. Okay.
And so, because they didn't respond, OSHA has to come out on site and do some evaluation. And as with any evaluation, if you get an account audit, they are going to find something wrong. And that's really what happened here. The practice then has this OSHA inspector come through and they find several things wrong in the practice.
So what else did they find wrong?
So they just discarded this request for information. OSHA shows up and now they're going to go through. And just a little sidebar here, from our over 1,000 inspections of practices in the last year, we found that the typical practice has 30 to 40 uncompliant issues. And to put that into a number that you can actually count on, that's over $100,000 worth of fines if they just take the average, not the max fine that could be levied for each one of those issues.
So your average practice, when they do an inspection, you're seeing 30 to 40 infractions, and these are practices that know they need help or they think they're killing it.
These are typically practices that say, you know what, I think I'm pretty good, but we're going to bring your services in and at least do an initial evaluation. And so I would say that those are probably the practices that are a little bit more compliant on average. We've seen some practices get down in the 30s and 40% compliance on our 120-point inspection. So it can be way worse. And it all comes back to this Pandora box of people not wanting to deal with issues that they feel like are outside of their job description, or, you know what, it's not bringing me in money, so I'm not going to deal with it.
Wow. Okay. So they had the issue, they remediated it, they didn't send in the letter, the inspector comes.
And now they've found several other issues. So let's walk through what they found. So their exposure control plan, the practice had not updated for at least in the last 12 months. It has to be updated at least annually. The plan was outdated, leading to an additional $9,000 penalty. Then the training and hepatitis B vaccination documentation.
Ugh.
So you know how that is. Like in OSHA, if it's not documented, it didn't happen. The practice may have been doing everything right, but they didn't have it documented correctly. And because they didn't have it documented correctly, that's an additional $9,000. And so in total, these violations added up to $18,000. And then you add in some other issues that weren't related to the bloodborne pathogen standard. And now you're at over $30,000 in OSHA violations.
So as you know, I just had to deal with the hepatitis B situation where, you had a client who is doing the bloodborne pathogen training. It says that it was required that they offer that. They had no clue. And they didn't dismiss it. We just found them a vendor and it all worked out.
Yeah.
But we learned that from the training and we didn't even know that that was our responsibility.
Exactly. And that's typically the case. It's not this willful ignorance. It's, you know what? I'm just staying in my lane. I'm not going to bring up any issues. But if you have any questions, the best thing to do is just open up your mouth and communicate. Ask some questions, reach out to somebody. Most of the fines that get levied are having something to do with this bloodborne pathogen standard. So not providing that Hep B vaccine at no charge is a very common way for a practice to get OSHA called on them. The employee sends in a little letter and now OSHA's at your practice. So you've handled it perfect. You just, once the issue comes up, you don't push it under the rug, you deal with it head on. But now let's talk a little bit about how you actually move forward. So what would you suggest that people do who are having problems establishing who's responsible for a task in an office?
I mean, that's something that we have to do all the time when I come in. And so the first thing is creating that emergency action plan. And so an EAP, as it might be called, and that is going to cover the most of what's happening in your practice. Now, this isn't the only OSHA thing, of course, like that exposure plan, and there's other things that need to be done. But if you're trying to assign responsibility and know who's responsible, that emergency action plan is going to let you know who needs to do what, who's responsible for it. That would be my first thing, emergency action plan.
Yeah, and that emergency action plan is a great place because, and with all these documents, that's what they're there for. They're there to establish who's responsible for every piece of this program and what are we going to do to make sure it actually gets implemented. For example, an emergency action plan often has, here's where we're going to evacuate to if we have a fire in the building. Well, also in that document is Susan is going to be responsible for doing a head count to make sure that all the staff were safely evacuated. And so that's just one of those little pieces that's part of creating these programs that make it so that you know who's responsible for what. So in the end, this practice receives over $44,000 in OSHA fines that were completely avoidable if they would have just been following through with an established program and having in maybe their monthly safety meetings a quick little review of different steps. They would have caught this months or years beforehand and it never would have escalated to where it got to.
And beyond like the financial ramifications of that, which again, $44K is hard for anyone to swallow, but I'm just thinking about the team and the stress that they went through trying to navigate that. Sometimes the fingers get pointed, which please, please, please don't finger point when these things are happening. It doesn't solve it. But when you think of the revenue loss, not just spending that $44K, the stress on the team, navigating all of that, it's not the environment that I would recommend in a practice, especially when it is avoidable.
Absolutely. And even beyond that, it's the potential reputation hit that you take. It's the, and we kind of joke about this, but there is what we refer to as a wall of shame over an OSHA. And every time you have a violation, it goes up on their website in its public domain. And now you're a part of the OSHA wall of shame. And nobody wants to be there, especially for something so silly as some mold in a cabinet in your office.
That you resolved and didn't send the letter for.
Exactly. And so ultimately, the whole point of this whole story is just to highlight how a simple little issue can get blown out of proportion if you just don't respond appropriately. And that's when sometimes you need that expert advice, that third party to come in and say, you know what, you're not handling this correctly. We need to have a little huddle here and resolve this issue and get it taken care of right away.
Thank you for sharing. I know that this is something that could happen to any practice I've been in, especially just burying your head and not finishing the steps. So these are great things for me to stay open and keep my eyes open on.
Absolutely. And so until next time, stay compliant out there.